Anisha?
Good,
Fine, go ahead. Good.
good evening and welcome to ISW Council's special web show on Irritable Bowel Syndrome care. I'm Anisha Nayar, Dhawan, your host for the show. As India grapples with the crippling COVID-19 second wave, safety and good health again take center stage. It has been ISW Council's endeavor to make good health, good air, and clean water the cornerstone of our initiative to build a healthy India. The irritable bowel syndrome, IBS, has so far been seen largely as a Western disease with a significant worldwide presence. It affects about 10 to 15% of all adults. Although IBS is not a life-threatening illness, it significantly decreases the quality of life and has a huge healthcare and economic burden. IBS is thought to affect about 1 in 5 people at some point in their lives, with the onset usually between 20 and 30 years of age. Around twice as many women as men are affected by this disease. The condition is often lifelong, although it may improve after a few years. Now, the exact cause of this condition remains unknown. Now, medications and lifestyle changes help to alleviate the symptoms of IBS. Unfortunately, IBS in almost all cases remains lifelong, and there is no permanent cure of the disease. Untreated and unmanaged, IBS significantly affects the quality of life. The Integrated Health and Wellbeing Council, a not-for-profit organization engaged in health and well-being of citizens, is glad to host a live session on irritable bowel syndrome care. The objective of this summit is to raise awareness about the disease and bring domain experts and professionals together to discuss the best practices of IBS management. So, without further ado, please welcome our experts who are joining us today in this panel discussion. Please welcome Dr. B.S. Satyaprakash, gastroenterologist, Dr. Satyaprakash Center for Digestive and Liver Diseases. We have Dr. Govind, Makharia, Professor, Department of Gastroenterology, AIIMS. We also have with us Dr. Ajay K. Jain, HOD Gastroenterology, Choithram Hospitals and Research Center from Indore, and Dr. B.V. Goswami, HOD Gastroenterology, Dispur Hospitals, who's joining us from Assam. A big welcome to all of you. Thank you all for sparing the time to join us for this discussion today. And we're really grateful to you for having taken out the time to join us and share your knowledge with the audience. First off, very simple question to Dr. Makharia. Could you tell us what is irritable bowel syndrome and who gets IBS?
Well, thank you, Council, and thank you, Anisha, for this event. And good evening, everyone. So IBS is a common disorder. And IBS, irritable bowel syndrome, which we call in short IBS, is a disease of intestine, mainly large intestine, where intestine has a motility. So if there's any kind of disability or kind of any difficulty in motility of large intestine, it produces some form of symptoms. And the three important symptoms which are there, that is a pain abdomen, there is a change in bowel habit, either constipation or diarrhea, and they all this pain improves with passage of stool. So this kind of symptom complex is IBS. And this occurs because of any form of abnormality in the motility of large intestine, which can lead to this kind of symptoms.
Right. So Dr. Makharia has told us what it is, but in plain and simple terms, Dr. Satyaprakash, I'm still trying to understand. The intestines have motility. I mean, they're still inside our body. They're not going anywhere. So, I mean, and the symptoms that you're saying, change in bowel habits, this happens so often. Sometimes you're constipated, sometimes, you have loose motions. Nobody gives this a serious thought. How long will these symptoms persist for you to want to investigate and say that this is IBS?
You're right, in the sense that the symptoms like irritable bowel syndrome are present in the community or our society quite commonly. If you just go out and ask a group of individuals, do you have any of these complaints? At least 50-60% of these people can say, yes, I do have it. But you may ask why these people are not taking an opinion or a consultation. Because such things are so common that the people always try the home remedies and they blame their food and the environment, everything, and they don't feel it is necessary to seek a medical attention. But there is a tolerance level, or there is a certain amount of acceptance of those symptoms, and there's so much of knowledge is flooded in the market that anything and everything you need to get checked and you need to be worried, and you have somebody and you see in a serial somebody having a similar complaint, having some serious disease. So the people get worked up for those complaints which they thought they are not significant, and at one particular point of time they get more worrisome and concerned about that. So we do have a set of complaints in the society for which the people are not willing to take any opinion, or at the maximum they approach their own general physician for the advice, and very rarely they come to people like us at the end when they are fed up with they are not getting the right answer for their complaints. Probably they seek a little higher and higher things.
All right, Dr. Jain, now Dr. Makharia mentioned something about the intestine. So when it comes to IBS, there's something wrong with the intestines. Is there something wrong with the diet? Is it just a factor of age? What really causes IBS? Dr. Jain, would request you to unmute yourself, please.
First of all, thank you, Anisha, for organizing this important panel discussion for the general public. See, in our society, if you start from Vedas, everything starts from the diet and the bowel habits. And so anything goes wrong with your body, and everybody in the family starts blaming your bowel habits, your diet, and your abdomen. So what happens is that over a period of time, this society is obsessed with your abdominal symptoms. If you are having a chest pain, they will say that tera khana theek nahi hai. If you are having abdominal bloating, then rather than trying for the proper medication, they'll say that your digestion is theek nahi hai, tumhari bowel habits theek nahi hai. So the concept of irritable bowel syndrome is a distinct clinical disease. But it is so often mixed with so many other things that everybody starts thinking that whatever is happening in the body is because of the disturbance in the abdomen, and then they ultimately get labeled as like irritable bowel, and then they keep running from pillar to post rather than going to a particular doctor, getting it properly investigated, finding it, is it really an irritable bowel syndrome or is it something else? Secondly, irritable bowel syndrome should not be discarded as a disease of a psychiatry or a disease of stress of the, yes, stress does play a role in this thing, but you need to give a time to the patient, try and understand what the problem is, and many of times there are simple problems which can be solved and without any treatment. So it's not that just an irritable bowel syndrome, it's a whole concept where it's not only the disease, but your nature, your surroundings, your environment, your work, everything comes into play, and then you need to address that particular issue properly.
All right. So, Dr. Goswami, as a regular person who is sometimes, infrequently have some constipation, when is it that I must get this seriously investigated? When should my alarm bells ring off that this is not a regular, occasional constipation or something with the digestion, something that you ate, but something that needs to be investigated? And what are the investigations? How do you find out that you have IBS?
Yeah, it's a very interesting question. The point is about the definition. Already Makharia has discussed about the exact definition of the IBS. So basically, simple way for the people, it is the pain or discomfort around the abdomen, along with the alternating bowel habits, either constipation or there is diarrhea, sometimes of these two. So that is what we have got today. So bowel habit is an important point, and along with that there should be some discomfort or pain abdomen is another important thing for IBS. So now point is somebody has got or complaining about the constipation. So all the cases we should not go for the investigation. As a whole, if you think that somebody is coming to us with the typical symptoms of IBS, we don't have to go for any type of investigations if number one, the patient is a young age group, if there is a typical history of IBS, typical symptoms, pain abdomen, constipation, or diarrhea, or sometimes in mix, and if the patient has got the history of stress, anxiety, so these three things, if it is included, then we don't have to go for any investigation. Simple way, we should take care, take the history properly, you consult properly to the patient, assure them, and give some medication on the basis of the symptoms. If suppose the patient has got some other additional features like weight loss, like anemia, like is more than 50. So these are the points where we have to go for investigation to rule out the structural disease of any constipation. Then only we have to go for the investigations like the routine blood test, special blood test sometimes may be needed. Then we have to go for even colonoscopy to rule out the structural problem of the constipation. Otherwise, we have to deal with them as a IBS patient as far as possible, not to go for the maximum level of the investigation. Because if you see the patients with IBS, most of them, they used to go to from one doctor to another doctor, and all the time they they will be investigated all the ways. Long list of investigations. All the papers they used to carry to us after some years together. Still, we don't get the diagnosis because the abject problem is not properly focused and not properly discussed by the doctor or physician or the surgeon, whoever it may be.
So it may be because they have gone to people who are not specialized, who are not able to recognize this problem. Dr. Makharia, you said the motility of the intestines is affected. Dr. Goswami said that if you have pain in the abdomen, so this pain in the abdomen must remain through the day, morning to night. Does it feel like a heaviness, or is it like severe pain? For somebody who's trying to figure out what is happening with them, what is the typical symptom like?
Before we go to typical symptoms, let me round up the first line of responses from all and make a story to what this IBS is and how are the GI symptoms appear. So I can take a couple of points to make people understand what IBS could be. First is that if there is any organ, we know our GI tract gets a lot of stimuli every time because our GI tract is exposed to so many toxins, food items, toxins, drugs, and so many things. So this GI tract is always overloaded almost every day with a lot of things. So it has to be very sensitive to pick up that something abnormal it should produce into symptom. And let me remind, the symptoms are good for us. Those organs which do not produce symptoms, they keep getting themselves damaged without we realizing it. For example, liver is one organ. Liver get damaged, it does not produce any symptom, no pain, no fever. It keep damaging itself, and the time comes when the liver has only damaged quite late. True. So many organs have early symptom, which leads to slight or skin. Little amount of trauma to skin, you become painful. It leads to pain. Not to liver. Liver also exposed to a lot of toxins every day, but it remains silent. It doesn't produce any symptom. The GI tract will produce symptoms that if they have any change in pH, like acidity of this food items, or any toxins, or any infection, foodborne, waterborne. So they always have a stretch receptors on the GI tract, which get altered. And this alteration in the GI tract receptors leads to symptoms of discomfort or pain. This is number one. Number two, that so GI symptoms are very common. As all of panelists said, that GI symptoms are very, very common, And I can say that almost every second person at one point of time, if you do a survey, at least one third to one half people will say, I have some GI discomfort, pain abdomen, heartburn, blotting sensation. So at one point of time, if you survey the whole country, you'll find half of them will have some GI symptoms. So point two, so GI symptoms are very, very common in our population, which may remain for days, it may remain for weeks, it may remain for months and years. So all of us have a GI symptom for days, doesn't matter, they all recover. Because of some amount of food toxin, some amount of infection, some symptom appear, they disappear, does not matter. And will happen to everybody of us almost every year, some GI symptoms. No bother, not to bother. Second point is why GI symptoms are important, because in our culture, as Dr. Jain also said, that in our culture we are taught from very childhood that if you have not passed stool today, it's abnormal. Therefore, our mindset is that we want to pass stool every day. If you're not pass stool, your mind is fixed there. Oh, I didn't pass stool today. Therefore, something is not good for my health. Something is not good. So, or some people will say blotting, some discomfort. So these are symptoms are very common, which are normal for all of us, but they are perceived as abnormal. So our culture-wise, the Indian Vedas and all, they say that you should have a bowel movement every day, which may not be true. We say if you have 3 bowel movement a week, that's fine. So this also brings to our perception or our fixation of our center that we must have a bowel movement every day. So this is 2 points. So looking at the symptoms of GI are very common. Looking at we also have been taught from our childhood that GI symptoms, you must have a bowel movement every day. So combined together, the GI symptoms and perception of GI symptoms are very, very common. And I also said that GI symptoms will appear because GI is exposed to lot many toxins every day, food infection or toxins.
So Dr. Makharia, are you saying that these common GI complaints are encompassed in IBS, or is IBS completely different?
No, IBS is completely different. So these are the GI symptoms. So what is IBS? IBS would be a chronic disease. So somebody has pain abdomen or diarrhea. So suppose somebody gets a simple viral gastroenteritis, which goes in 3 to 4 days. They will have diarrhea, they will have pain, but in 3 to 4 days, with some education, they are fine. So this is not IBS for sure. This is the acute GI infection. So IBS term first is chronic. Chronic means which comes and goes or stays for a long time. Symptoms are there for months and years together. There's a pattern symptoms. So there's a pattern of GI symptoms in terms of pain or discomfort. Pain means pain severity also varies. GI pain are not very severe. Severe pain is not IBS. Okay. Severe pain could be organ-specific. We take abdominal pain, and abdomen we know has at least 10 to 15 organs. So if they have pain from any of them, they will have pain abdomen. How do I know it's my pain is from gallbladder or pain from pancreas or pain from intestine or pain from stone, kidney stone? So but there's a pattern of pain. So each of like gallbladder pain has different characteristics, which as a person I may not know, but my doctor will know that how the pain bill of gallbladder pain is, what kind of pain is gallbladder pain, what kind of pain is pancreas pain. This is what our training is. What kind of pain is a renal stone pain? What kind of pain is which are more like you must look at, you shouldn't ignore that. What kind of pain which are fine, or there's no problems. So there's a pain which comes and goes. Also altered bowel habit. So GI movement, once we eat food, the food goes from food pipe to stomach to small intestine where it get digested, and what rest out goes from the colon. So colon always have a motility because colon has muscles which put all the rest of the waste product from one part of the colon to the end of it, and then out. So any abnormality in that, which can be perceived as a constipation or diarrhea. Increased motility, diarrhea. Low motility, constipation. So this kind of pattern of pain abdomen, constipation, or diarrhea persists for long, comes and goes, stays for weeks. That could be qualified for a diagnosis of irritable bowel syndrome.
Okay, Dr. Jain, as much as I understand, this problem IBS or a disease doesn't have a cure. So you're saying it's not the usual constipation that you get once in a while that you get over, or the gas that you get that sometimes will give you a shooting backache. This is something that is chronic. It stays with you. So then what do? You live with it. How do you manage it?
Okay, Anisha. So let me just, what Dr. Makharia has said, let me clarify that every abdominal symptom which person gets is not IBS. IBS is a distinct clinical disease which we need to diagnose. And once you diagnose it, the treatments are available. Sometimes these treatments are very successful, sometimes they may not be successful. Because the treatment doesn't mean that what is the problem, you just treat it. Because how the person perceives. Suppose I have a pain and I take one painkiller and I said, no, I'm okay. There's a similar degree of pain to other person. You give him, there's no difference in this pain. So the perception is also very important in the treatment of irritable bowel syndrome. Having said so once you diagnose an irritable bowel syndrome, one of the things is that you need to understand the personality of that person. Because there is a lot of stress factors, there are a lot of obsession in these patients. They are obsessed. You ask them what happens, they keep repeating that symptoms again and again. You try to explain them, they may not understand. Some of these people may be intolerant to certain food also. Suppose in India, we have a good percentage of people who are intolerant to milk. And when they consume milk diet or excessive milk, maybe the sweets or other thing, and they get abdominal bloating, and then they perceive it as an irritable bowel syndrome. And once they go to a doctor and doctor says, okay, you avoid lactose or you take lactose-free diet. And they will not accept it. Oh, how will I live without the milk? Because milk is like God in this country. And you have to have milk and milk products every day. And then they keep running again. So they will not understand this. So the first thing is they have to understand the physiology of the symptoms. Okay, you have a problem. And the basic problem is it may be a food intolerance. It may be your stress related. It may be your work relations. And then once you diagnose them, as Dr. Goswami said, if there are no red herring signs, you don't investigate them much, you assure them. The most important part of treatment in irritable bowel syndrome is the time given by the physician to the patient. If you spend 5 minutes extra, talk to the family members, try and understand his basic problem, assure them that, okay, these are not the one which will live. Many times these people have symptoms because somebody in their family had similar symptoms and was died after that. And they perceive that, oh, I have the similar symptom that I have a pain in here, I have a pain here, and then you investigate them, nothing happened. So there are many factors which contribute to these symptoms and you need to understand them. Once you understand the physiology, then you start treating them. Some of these symptoms may be small intestinal bacterial overgrowth because of bacterial overgrowth. Another common problem in our country these days that majority of us have started taking medicines from the counter. I have some burning here, I have some acidity, and I go to a shopkeeper, get the antacid, get the H2 receptor blocker, get the PPI, pentosate, omeprazole, all these kind of drugs. And then they keep consuming because I take it and then some of these drugs may have side effect in the form of small intestinal bacterial overgrowth and all those kind of things. And you treat them and they become all right. So third thing in these things is that you need to treat their symptoms. If they are having pain, you need to give them some gut tranquilizer so that their pain is relieved. If they have got diarrhea, you need to control their diarrhea because ultimately the person has come to you. You may say that you have no disease, but he has symptoms. So you have to give them a symptomatic treatment. So for anti-motility drugs in case of diarrhea, if they have constipation, you need to make them understand what is the constipation. Dr. Makharia said, if you're in our society, right from the childhood, mother keep coming with the hospital. So my child doesn't pass a stool every day. What's wrong with it? If he's going for a bowel movement, once in 2 days, it's fine. So we have to make them. Some of the people come that as soon as I take my food or after the break, my husband, my son, they go to the toilet after eating the food. There's no wrong. This is, oh, आपने खाना खाया और toilet चले गए, वो तो सब निकल जाएगा. they need to understand that the food doesn't reach to the rectum in say 3 hours, 4 hours or 6 hours. It takes time. So you have to assure them, you have to address their fears, and then you have to give them a symptomatic treatment, which may be some anti-motility drug in case of a diarrhea. It may be laxatives in case of a constipation. Sometimes they require, some do require some kind of tranquilizers. And lastly, if the things are so bad, some of these people do require psychiatric consultation, and one should not hesitate in getting a psychologist opinion to understand their mental health, and then getting a psychiatrist reference and getting some of these drugs will help them tremendously.
Sorry, the psychiatric drugs, you're talking about anti-anxiety drugs?
Yeah, anti-anxiety. Some of these patients are depressed, so antidepressant drug, tranquilizer, they do help a lot in these patients. And you will find majority of gastroenterologists who are treating irritable bowel syndrome will write one or the other anti-anxiety drug or tranquilizers or antidepressant drug to treat these patients, because it's not possible that every patient will refer to a psychiatrist. So you have to have a psychiatric component in your treatment armamentarium.
All right, Dr. Goswami, Dr. Jain has brought in a whole gamut of issues. It could be intolerance to particular kind of foods, even stress could get you here. What are the other things that get you to the IBS? Could you prevent IBS from coming on to you? Are there healthy habits that can keep your intestines in tip-top shape?
Yeah, it is a difficult thing, practically difficult or practically impossible thing. I think so. The point is what Ajay has mentioned. First of all, as a specialist or gastroenterologist, our aim is to talk to them properly. The patient-physician relationship, that is the key to the treatment of IBS. You give some more extra time, you talk to the patient, talk to the attendant, explain to them the problem. You have to explain to them that there is no serious issue along with the intestine or in the brain. You just keep on, and ultimately they will understand it. It should not be a negative or the diagnosis of exclusion, what say 10, 15 years back we thought of. It should be a positive thinking, a positive diagnosis. We should give importance to that. We have to remember the patients with IBS average, the time takes is almost 4.5 years before they can get a proper diagnosis of IBS. So a lot of time, almost 75% patients with IBS, they come to a doctor after 1 year of suffering from the problem. Or almost 65% IBS patients are not diagnosed at all in their lifetime. So this is the problem. So after that, the consultation, then you go for the symptomatic treatment, what Ajay has already mentioned about. So I think most important thing for us is to the physician and the patient relationship. We should give importance to them. And again, the studies they are showing now that if a doctor has explained properly, has got a good consultation, there the patient visit will be lesser and lesser. That means the patient is satisfied with their consultation. So that is the thing all of us as a physician we should know, and also the patient should realize it, that it is not a big issue to have the IBS. Only the conception or perception they have to change during the time.
All right. So definitely, if I trust my doctor, I'm sure I'll feel better automatically. Dr. Satyaprakash, so far, IBS is seen as a Western disease, as a disease that affects Caucasians because they eat a lot of processed food, they eat a lot of red meat, their diets are different from us, and hence, it was seen as a Western disease. In your practice, what have you seen? Have you seen an increase in the incidence, or is it being diagnosed more? Are Indian diets somehow, Indian diet itself helps you from, not getting some of these symptoms?
You're asking me?
I'm asking Dr. Satyaprakash.
Okay.
So could you please unmute yourself, Dr. Prakash?
If I say the world is a global village, there is nothing like East or West. Now, see what all you have, they have, what all they are eating, we are eating. The lifestyle is more or less the uniform, starting from our habits, lifestyle, and even drinking or smoking habits is more or less universal. There's nothing like West or East. In fact, the problems are more or less universal. So it may be the awareness of that problem might have been identified little earlier in the Western population because they are more educated, a cross section of the society compared to majority of developing countries, I would say. But the people who seek the medical advice, more or less the same. In fact, recently we have done a study. We found that the incidence of complaints, initially they were telling the North Indian, South Indian was little different, but East and West are little different. Though our lifestyles are different, our dietary habits are different, being in our own country, the incidence of symptoms are not different. We do have it. Across the country, same amount of incidence is seen, and East and West also the same incidence is seen. It is, I would conclude and say there is nothing like East or West, we are all one. I liked your question of how do we keep our guts in a tip-top condition. That's what you asked the question to, Goswami. In fact, this is the commonest question posed by our patient population. Sir, I have these complaints. How do I keep my guts fit and fine? So, it is a very easy question with a difficult answer, I would say. So, bowel symptoms are not just related to our dietary habits. Your mood affects your bowel. Your psychological stresses will affect the diet. At the time of eating, how your mood is. Are you anxious and you're eating, gulping of the food? Or you have enough time to chew the food and eat and see? So these days, the people gulp the food, actually not seeing what they're eating.
They're distracted. They're watching TV or they're seeing the mobile and they're eating at the same time.
Sure. Eating their lunch, seeing television or watching a movie and eating, what goes in the mouth, hardly the brain knows. It is something like that. So I would say your bowel condition will be tip-top provided you take care of your proper dietary habits. I would say timely food, proper food, chew the food, have adequate water, include fresh fruit and vegetable in your diets. More importantly, drinking of water is very important, and you may be surprised that the people drink more of aerated drinks and then the drinks which are not actually to be consumed more often, and they are actually not drinking adequate water. And most importantly, the improper dietary exercise habits. People don't have time to do exercise. सबको यही problem है, हमारे पास time नहीं है. So for eating there is no time, for sleeping there is no time, for doing exercise no time. This is a common thing. That's why I said it's a very difficult question to answer and please anybody. So after listening to everything, you tell some medicine, I will take it. So the people's expectation is always something like a shortcut.
Pop a pill and get fine.
Yes. They don't want to invest their time and money for disciplining themselves and then changing their lifestyle and they expect the outcome. So once we are coming out of this so-called fast life concept, understand our internal physiology, that we also need time for ourselves. You always work for somebody else, but you are the only person who have to work for yourself. So you have to devote time for your food, sleep, exercise, to see that everything goes well.
Right. Dr. Makharia, I want to understand from you, why does the onset of this disease start only, say, 20, 30 or later? Why don't young people have this problem? Dr. Makharia, could you unmute yourself, please?
Add on to Dr. Satyaprakash made a very, very important that how do you keep your gut healthy? As it is very well known that how do you keep your heart healthy? That you do exercise every day, you keep your BP control, you keep your diabetes control, you keep your lipids control, you keep your diet control. So there are 5 things which you do for keeping your heart in good shape. And should start early part of life. You don't start such things at 60 years of age when you're at highest risk. You start all these at early part of life, you can prevent heart disease. Similarly, if you keep some of these things that Dr. Satyaprakash said, keep in your general diet, then certainly your GI tract will remain healthy. Not only GI tract, but also liver. Liver, tomorrow is a World Liver Day. So again, I take this opportunity to just to remind that liver is a very vital organ, and 3 things to keep your liver healthy. Number 1, that avoid fatty liver. Fatty liver means if you are high weight, then control your weight. Most people with high weight will have fatty liver. There's no doubt about it. You test yourself or you don't test yourself, there's a fatty liver. And therefore, fatty liver is the risk to your long-term liver damage. So keep your diet in good shape. Don't take extra fat. Do exercise every day, a little bit, at least 30 to 40 minutes every day. And third thing, if you can avoid alcohol, that's the most wonderful thing one can do to yourself. So 3 or 4 things to do, keep your liver healthy. And one other point I want to make, just to highlight or give emphasis on the point Dr. Satyaprakash made, that how will you keep your GI tract healthy? 2 things, that what is good to your tongue may not be good to your general health. And we like sweets, is very good to have. You like salty food. Salt is not good for blood pressure. Sweets are not good for your sweets, or good food, fatty food which you like is not good for your general health. And we live in an economy. All the industrialists know that giving anything attractive to humankind, they will get attracted and will take it. Therefore, we never have obesity of this nature which we have today, because the food industry, because for industry, they pumped all those things which our tongue will like cola drinks, or like fatty food, like big burgers with a lot of fat. So therefore, humans will always be challenged by economy or industry, which may not be good for your health. So it's about self-discipline of some nature. Nobody can be 100% disciplined, but little discipline might keep us GI tract healthy. And taking your question that why it starts in 20, 30 years of age and why not in childhood. See that IBS does occur in childhood too. It's all about what is IBS. IBS is, if you look at the GI system, and if you look at by any test, do your endoscopic test, you look at in the lumen of GI tract, you do from outside, do a CT scan or MRI, or even you examine the intestine, they are normal function. There's no abnormality. The structure of GI tract is normal in them. Just about functionality of it. So it does not function as well as it should do. And second point is that there's a hypersensitivity. The same amount of injury or same amount of discomfort to it may look to be painful to one, it may remain painless to someone. And in our society, we have 2 kinds of people. One are called health seekers, one are called health non-seekers. So those who are health seekers, even with a 1 on 10 scale symptom, even with a scale of 2, they will go to a doctor and say that, oh, I have this kind of symptoms. There are also people in a society with scale of 5 on 10 may not go to a doctor. And therefore, they would do home remedy, or even they ignore those symptoms. So in IBS context, there's no abnormality in GI tracts, so there's no risk to life. It does occur in childhood also. Now with if you look at young children, even in school-going students, you find they have constipation, they have a change in bowel habit, they have pain abdomen, and if you combine them together, they may qualify for IBS. So probably this is misnomer that IBS occurs in 20 to 30 years of age. It occurs in all age groups. With all age
Okay.
groups, it occurs. Only to even at 60 years of age or 70 years of age, IBS does occur. What happens once we look at this scale of whole age distribution, there are bars which are high at 20, 30s of age. And there are bars which are at later age or early age, they are smaller bars, 5%, 10%. But the bars are bigger at 20, 30 years of age. But IBS can occur at any point of anyone at any age. And once they're an IBS, if they are there, it may last for a longer time. I want to say two more things at this point in time. That if somebody diagnoses IBS, nothing to worry about it. If diagnosis is right, then the most important thing is not a cancer, is not tuberculosis. It may trouble you in terms of symptoms, but there's no risk to life. It may have a value on your quality of life because you suffer. Your quality of life may be diminished, but there's no risk to life. And a single point that IBS is a non-killer disease will never lead to increased mortality or any kind of. Certainly, patient does suffer with these kind of symptoms.
Right. Dr. Jain, what Dr. Makharia is saying that this is not brought on by advanced age. This is a difference in the functionality of the intestines. There may not be anything structurally wrong with them, or they may not be diseased. They just function differently from regular people, and hence, that's how you get IBS. So, what makes A more susceptible to the functionality of your intestines not being 100%? Is it your genes? Is it your lifestyle? What causes your intestines functionality to change?
I'll just extend what Dr. Makharia has said with one simple anecdote, and then I'll address. So every irritable bowel syndrome, with how I treat them and how I tell them is, खुशियां किसी सब्जी मंडी में नहीं मिलती हैं, खुशियां आपको खुद ढूंढनी पड़ती है. And I'll just quote an example. About 6 months back, a 10-year-old girl was brought to me with pain in abdomen, and all other investigations were normal. And when I interviewed that girl, so everything was fine. Then I asked the parents to go out, and I asked, what thing you like most? And she said, I like dancing. And because of this COVID restrictions, and she was not going to the school, she was not allowed to go out of the house. She could not go to her dance classes, and that causes the problem. The moment I told the parents, let her go to her dance classes, let her go out of the house and play with the kids and play with the friends, 6 months down the line, she has not taken a single drug for the treatment of pain in abdomen. So the treatment, again, as I said, Dr. Makharia has clearly said that it is the perception how you do. So the lifestyle is a very important thing in this. Nowadays, there are unexpected what we call it. You have expectations which are unaccepted. You have unaccepted competition. So you want to compete with your colleague, which is not right. आप अपनी लाइन तो बड़ी कर सकते हैं, दूसरे की लाइन मत छोटी करिए. आप अपने ग्रोथ की तरफ ध्यान दीजिए. आप क्या कर सकते हैं उसकी तरफ ध्यान दीजिए. आप सामने वाले से कॉम्पीट करके उससे आगे बढ़ने की कोशिश करते हैं. And all these put stress to you. Another example, my son got 99.95%. The other person got 99.98%. This is the cause of stress. So these are the kind of things, these are the kind of stress. So the work-related stress, the stress to go ahead in the society, the stress to get the importance in the society, maybe in the importance of the family, some unexpected gains, all these put stress. When you feel that I should have a car, you should have a car, but at what cost? No. So you have to have a pleasure in life. What all you do it with pleasure. What all you can achieve, try and achieve it. It is not bad to have ambition, but if you cannot fulfill it, if it is not in your abilities or capabilities, don't try and make stress out of that. So the first and foremost thing is that you have to have a pleasure in your life. As rightly said, these days we watch TV and eat food. Something which we enjoy food. We don't just इंसान बनाता घास खाने के लिए. ओवर ए पीरियड ऑफ टाइम हमने अपने आप को चेंज किया है. हम आज खाना स्वाद के साथ खाते हैं, उसमें खुशियां ढूंढते हैं. Somebody may enjoy a non-vegetarian food, somebody may enjoy a vegetarian food. You enjoy the food. The moment you start enjoying the food, half of the problem is over. The moment you enjoy your work, half of the problem is over. The moment you enjoy your extracurricular activities, half of the problem is over. Don't try and force things on one. This problem in the kids and the young generation about IBS, when the parents start fulfilling their ambitions through them, they want their kid to be a top notch, should be best in the sports, should be best in the studies, should be best in the debate, should be best in the culture, best in the society. How is it possible? Each person has got their own talent. If the talent is nurtured, if the talent is allowed to be nurtured, half of the problem will be over. So it's not just the treatment by the medicine. You have to give them a time, try and understand, and then you try and give them an assurance. Okay, you have a problem, but this problem can be solved with this way. You have an unexpected or unacceptable work pressure. Change the job, change the school, change your habits. If somebody likes sports and you force him to read and become a topper in the class, is it possible? No. But the sports itself is a good activity. You can nurture your child in that activity. So it's not a disease just because it starts with all these kind of things, and over a period of time, then it becomes chronic, and then obsessive, compulsive things starts. And from one doctor to the other, some of the doctors may give you enough time and assure you. Some of the doctors may not. Oh, you have a problem? Take this medicine. Go and get this medicine. So all these things further complicate the problem. So the best thing is, खुशियां बाजार में नहीं मिलती हैं, खुशियां सब्जी मंडी में नहीं मिलती है. आपको अपनी खुशियां खुद ही ढूंढनी पड़ती है, और जब आप अपनी खुशियां खुद ढूंढोगे तो आपकी बहुत सारी प्रॉब्लम अपने आप सॉल्व हो जाएगी.
So you've said it very rightly, Dr. Jain. But you know, this whole thesis of the brain and the gut connection, I can completely understand it in the case of children. Now, children cannot express, and sometimes they internalize their stress, and it shows, manifest in, you know, say, पेट दर्द. बच्चों में काफी होता है. Dr. Goswami, what I really wanted to find out was, you know, is this IBS happening because of higher inflammation in our gut? Because we are having more processed food, we're having a lot of sugar, and some people believe that, you know, these inflammatory products in the end do affect, there are too many free radicals in the body, and that affects your intestines as well. Is there any truth to this, or is it just the functioning of the intestines which is impaired, and there may be stress that adds on to it?
So it's for me?
Yes, Dr. Goswami, the question is for you.
Yeah. So this is one thing. For long years, we are talking about the brain-gut axis. So means our gut gives signal to the brain, and the brain gives the response to it. So in IBS, maybe the signal from the gut, not normal one, abnormally same, or the signal from the gut was normal, but the response from the brain may not be that much. It may be some abnormal thing. Then there may be some problem with the motility of the gut itself. So all these issues are there for long years. So after that, today, it is more acceptable. One is probably there is the changes in the microbiota of the GI tract, intestine mainly. There may be some changes, this balance of this microbiota, that can actually cause the symptoms of the IBS. That is possible. Then another point is coming up for last few years about the post-infective IBS. That means in the GI tract, there may be some infection the earlier years, for example, the virus or bacterial. So all these infections or some other toxic products also. So this infection may not be completely resolved. In some cases, complete cure was not there. Inflammation was not completely cured. So after that, for some time, these people, they may suffer around 20 to 30% of these people, they can suffer from IBS later on, where the resolution of the inflammation is not complete one. For a long time, if that infection is continuous, especially in the ladies, they can ultimately end up with the IBS. So these are all possible theories we have got today. So then again, the stress already is established. Stress and anxiety, yes, they have got the effect of the GI tract, and ultimately it can end up with the presentation of irritable bowel syndrome. So all these are possible, especially in the young boys and girls. They are very prone for the stress, and also they are prone for the infection, GI infection. So from there also they have got this problem of IBS later on. So in between, I just wanted to say something about what I have already mentioned, the physician-patient relationship. That is the point. I love it, and I try to, in my practice, to do the justice on this particular point. For example, one of my patients for almost 15 years now, young boy, he came to me with a lot of papers with him. He visited so many doctors for the typical IBS symptom. So many doctors he visited, and for so many years together. So then he came to me one evening in my evening clinic. For quite some time, I gave to him, talked to him, saw all the reports, and I told him that it should be okay, don't worry about it. So after 2-3 days, he used to call me exactly at around 9 to 9:30. That is the time I used to go to the medical college, start my work. Those days, there were very few assistants in my department in the medical college. So his timing was very odd for me because I start the work in the college and he will call me, Dr. Goswami, I have got this problem, I have got that problem, I have got loose motion. Yesterday I had the constipation. So all these problems he used to narrate to me every day. So after 3-4 days, I was thinking that something I have to do, otherwise his name was Mr. Joshi. So otherwise Joshi will almost difficult for me to continue my job. So after 5 days, I started calling him around 9 o'clock. So hello, Mr. Joshi, how are you today? So for 3-4 days, exactly at 9 o'clock, I started because I know that 9:30 he will call me. That time I started 9 o'clock. How is Mr. Joshi? How are you? So believe me, after 5-6 days, he was so surprised that Dr. Goswami is calling me, inquiring about my health and all. So then he became a good patient, and today he is a very good friend of mine. I think that is the part probably all of us we should give importance to the patient-physician relationship. That can help a lot.
So, Dr. Satyaprakash, what Dr. Jain and Dr. Goswami are saying, that part of this problem is psychosomatic. And if you assure somebody, a patient, that I understand your problem and I'm not going to dismiss it as regular, constipation or diarrhea or something that comes and goes, it gives them a lot of relief and it helps them in the symptoms as well. Now, can we do something to improve our symptoms itself? If we eliminate, certain foods, like Dr. Jain said, you may be lactose intolerant. So if you eliminate milk products from your diet, would that patient then improve? Do you think they would be in such a situation? Would having probiotic or prebiotics help you if in this situation where you have IBS? What would you like to say there?
I think the IBS group of patients are a different lot. A particular IBS patient's treatment may not be suitable to another IBS patient. Now, sometimes the dietary factors dominate in their symptoms. Sometimes the psychological overlay or the stress factors, will be the dominant in their disease or pathological spectrum. Sometimes their perception, they have a wrong concept, means they have real psychological problems. means they are little beyond a normal level of thinking. They have some sort of fears, phobias, aversions, more of anxiety. They are actually more of a psychological problem with a little of gastrointestinal complaints. So those are really tough people. They need a combined assistance by a trained psychiatrist and a team of gastroenterologists and also a proper dietitian. A team of these doctors are necessary to manage the so-called tough IBS. In fact, we call them malignant IBS. In fact, the doctors get scared to see such patients again and again because they take a lot of your time and they are never happy. And one of the panelists said they keep on repeating the same complaint to emphasize that they are really having a trouble. So a particular person, as you have rightly mentioned, they are convinced, if they trust you, they believe that what you are telling is true. And first and foremost thing, nobody accepts the term that you are okay, your intestines are all right, everything is fine, you go. That is what the patients don't accept it. In fact, the moment you say that, they will draw their conclusion in their mind that the doctor doesn't know my problem. So, in fact, they need to be educated about their symptoms, the origin of symptoms, and as you rightly mentioned, if the dietary factors are responsible, avoiding particular type of food like a milk or some sort of a nuts or some sort of a fiber-rich foods, some sort of a onion, garlic. That is what you are going to discuss about the FODMAP diet. Certain FODMAP substances also cause the IBS symptoms. So if you identify the problem, stopping that is a cure for the IBS problem. In fact, so many times I have seen people, especially in the IT group of people, I have cured them in one visit and they are thankful for the rest of their life. Sir, I've been visiting so many people who just gave the advice even without giving a medication. You asked me to stop all these things. I stopped, I am fine. So that itself is enough. Some people require a dietary support. Some people require a psychological support or assistance, clearing up their clutter in their mind that something, a wrong concept they are harboring is more or less enough. But of course, certain people may require anti-anxiety drugs, antidepressant drugs, because the psychological problem is representing as a GI complaints. So it is not actually the stomach is at fault, it is the mind at fault. We have to differentiate what patients require, what sort of a support or advice, and then a combination of support and advice will keep them happy.
So you're saying there is no one size fits all?
Definitely not.
Okay, so Dr. Satyaprakash, what is FODMAP diet?
So FODMAP is fructo-oligo-monodisaccharides and polyols. So this is a complex term of the substances which are present in a day-to-day life. So typical FODMAP is the milk. The milk has the FODMAP as a lactose. See, the other FODMAP substances, the complex carbohydrates which are difficult to be broken down. That is actually in a simple term. You take it, you may not be able to digest it. When you don't digest it, that food is available to the intestinal bacteria to digest, and their bacterial digestion will not be simple. They liberate a lot of gases, and that gas will cause the problem of bloating, discomfort, and flatulence and all those things. So there is a group of FODMAPs, starting from apple to dry fruits to oats and onion, garlic, certain beans. So most of these day-to-day food items what we consume are FODMAP rich diets. Luckily, all FODMAP substances are not allergic or are not averse to everybody. In that list of so-called FODMAPs, you may be sensitive to 1, 2, or at the maximum 3, but not the thing. So we should be cautious in giving a list of high FODMAP diet and a low FODMAP diet to our patients and ask them to see the so-called high FODMAP diet, which of the high FODMAP diet is responsible for your symptom. In fact, we tell them to keep a dietary diary. So keep on writing on the left-hand side what all the foods they have been taking, and on the right-hand side, what all the complaints they have been observing it. See a correlation. See, a typical example is if someone is sick, the people ask them to take a lot of milk. So a person who is not in the habit of drinking a lot of milk, suddenly Somebody says he wanted to go to a gym, he wanted to do a little workout, and he wanted to, suddenly he become health conscious. Somebody asked him to drink more milk. So the amount of lactose in a given person suddenly has increased. The body cannot handle the extra load of this so-called FODMAP. So suddenly they become intolerant. And unless that person knows that the problem is caused by himself only, he will not know that. He will try to make the problem bigger and bigger. So identifying a proper FODMAP responsible for his symptoms is a cure for him. And they also have to be aware of the so-called low FODMAP diets, and they should not be blaming those diets. They are responsible. In fact, someone says, I have a problem with the so-called low FODMAP diet, I'll ask him to think again and then give a serious thought to it. So don't blame the really safe food and don't accept really not safe food as the safe one.
Right. But Dr. Jain, when it comes to diets, there are a lot of fads and there's a lot of advice which is many a times contradictory. Now, Dr. Prakash is saying that complex carbohydrates may not agree well with somebody who has IBS because, hard to break down, the bacteria comes in and there's a lot of gas. But the common belief is that complex carbohydrates are good for you because they keep your insulin regulated and they're good for your body overall. So if you're advising the FODMAP or elimination of FODMAP to improve on the symptoms of a patient, how does one go about it? Do I cut out dairy for a month and then see if I've improved? If nothing has changed, then next month I cut out something else and see, remove onions and garlic and the high sulfur food and see if I'm better. How does it work?
Okay, so I'll answer in a little different way. So, ati sarvatre varjati. So, when Dr. Satyaprakash said that you have to avoid the food map, it's not possible that everything which you are eating will cause you a problem. All of us are different in different way. So, for one, food may not be good for me, but the same food may be good for the other, though he may have the similar kind of symptom. So, first and foremost thing that Dr. Satyaprakash has said, that you have to identify certain food which is causing you a problem. And then once you identify those food, you can avoid it, your problem will be solved. Now, regarding the complex carbohydrate, it's not that the complex carbohydrate will cause always a problem, but it causes problem when you start taking only that thing. So, if you look at our old system, generation after generation, we used to eat food which was available in that particular season. We used to have the cereals which were changed. We never used to be completely a wheat eater. So sometime we'll have a gehu ki roti, then other day we'll have makka roti, then jowar roti, bajra roti, kuttu, ragi, sigara. There are so many other food available. And this change every day will not cause you a problem. But if you continue to eat, if you have you have a problem with one particular food, you can avoid that food and continue with that food. The complex polysaccharide, especially the one which are very rich in fibers, when they reach into your large intestine, they get fermented, they produce a lot of gas. But it's possible that it may not be, it's only for a small group of patients, and that group of patient has to avoid it. But there are other complex polysaccharides which are available, which may be tolerated by the same person, but it may not be. So somebody may not be tolerant to wheat, but he may be tolerant to, say, corn, jowar, bajra, ragi. So they have the alternative substances. So that it's not like that कि यदि ये नहीं खाएंगे तो हमारी जिंदगी नहीं चलेगी. यदि हम दूध नहीं पिएंगे तो हमारी जिंदगी नहीं चलेगी. The other important thing which has happened is our food habit has changed significantly in last 2 or 3 decades. And this change in food habit probably has led to a change in our microbiota. This was discussed by Dr. Goswami. And change in microbiota has also led to some of these things. So if we can analyze that thing, then it may help it. Because I remember in my school days, I never had a cheese. I never had butter. This was all the thing. Roz subah sham ghar ka bana hua taja khana khate the. But now we all have this fermented food, cheese, and that. So your microbiota has changed. Your cellular structure has changed, and similar to that, the other things has changed, which has caused the problem. So what again you require is to identify the problem and get out of those food. So the food diary is one of the important concept and a treatment in the IBS. The second thing is, sometimes you just in one go, if you tell the person that you have an IBS, he will not be satisfied. You have to satisfy that person. Sometimes you have to write drugs also. Certain drugs are important in these patients. And third, because of the time is spent, because of some of the investigation you have done, if you give time to review their old investigation, write some medicine, you buy their confidence. The moment they have a confidence in you, and then you start telling that, look, you have to avoid these food, or you don't have to avoid these food, you have to. Last and most important, ask these people not to do a Google search, not to read all those health snippets coming in the newspaper. So tomorrow somebody says, what do you call this? All these people, I'm forgetting the name. The certain Indian items like aaj ye dal chini dal lo, aaj ye tulsi ka pata. All these small things which are age-old remedies in our grandmothers and all that. But when they start getting more and more, I'll tell you the best example of this kadha during this COVID days. People were given that the kadha will be boosting your immunity against this. So people started with small dose, and then they started gulping 3 glasses in a day, 2 glasses in a day, 4 glasses in a day. And ultimately they came with certain symptoms. And those symptoms were because you have an excessive thing. So all these indigenous drugs, which is available over the counter, about which you have no knowledge, and you have just read in one of the newspaper item or one of the dietitian that this will boost your immunity, or this will boost this thing, or this will help in preventing your hair fall. Because all food may not be good for everyone. So you have to be very careful. And lastly, this gym business. Now, when you go to the gym and all these people are giving you certain products about which you are not aware about it. And then they come with the symptoms of gastrointestinal bloating, pain and all that. And sometimes you try to label them as an IBS, but that may not be an IBS. So you have to be very careful. And the most important thing, again, coming back to the treatment of IBS, how much importance do you give to your history taking? How much time do you spend in asking them all these things, food habits, their dietary habits, their exercise habits, their work-related problems, their family problems, and then identify and treat them. So ultimately, it's just not one small thing or one big thing. It's a complete complex
combination of things.
Yeah, combination of the things which you have to address at one particular time.
All right, Dr. Makharia, Dr. Jain is saying sometimes you have to, prescribe a medicine to gain your patient's trust. Now, I have bloating and I have mild pain, and I've been having this for a long time, and I come to you and you say, perhaps you feel that, it is more stress related, and you advise a neuromodulator or an antidepressant. And the patient's like, hello, I have a stomach ache and you're giving me depression medicines. How receptive are they to take these medicines?
Certainly, they won't be receptive, because this is a common sense that if you give antidepressant or anti-anxiety or refer to a psychiatrist for their abnormal ailment, they won't appreciate it. No doubt, right? No doubt, none of us will appreciate that unless explained appropriately. What this drug can do to your GI tract also. Those drugs which works on mind, they do work on GI tract. So these drugs are prescribed only in a very small subset of patients. You look at a large number. So again, you look at IBS. IBS would be, if you look at, you have 100 IBS. So I would say 80 to 90 would be good IBS, where also 70 to 80 will be good IBS, which follow your dietary restrictions, your food habit, little bit of talking to people, allaying the anxiety about the disease. All these will work, and along with drugs for constipation, drugs for diarrhea, drugs for pain, it works in majority of patients. But certainly 20% of odd patients will require, 20 is a large number in a country like ours, that they will require additional therapy, they require additional tests and additional therapy. So what the principle of IBS treatment are twofold. Number one is that reassure that everyone who has been diagnosed IBS must get reassured and should get reassured through this program that IBS is a non-killer disease. Therefore, you should not worry about it. If somebody in the family had died of colon cancer, does not mean you have a colon cancer. So point number one. Point number two, that IBS occurs is a multi-step process, what we call multi-hit process. So there's always a background of IBS, for example, by genetic or by minor gut inflammation because of various reasons. And third, because of microbiome, change in microbiome, because changing society, changing microbiome, all our microbiome are little more, I would say, more aggressive compared to more conservative. So all of us have that. So we have a little more aggressive microbiome. And microbiome, we can tell everyone that in our intestine, there are trillions of bacteria. Like our expected economy of 5 trillion, we have that many bacteria in our gut. So they are all good harm. Some are good bacteria, some are more aggressive bacteria, and they are good harming. But now somehow with the changing society and changing dietary patterns, or this bacteria is changing with time. So we have only a background of to develop GI symptoms. On top of that, now you have a stress. You have a diet. So certain food items, for example, high FODMAP diet. So this is a trigger for this individual. So he was good at this point of time. He started taking some dietary changes or stress, which led to precipitation of symptoms. We need to understand first, and all of us people who have these kind of symptoms should understand that all these measures are equally important. For some, diet works better than drugs. And what Dr. Prakash and Dr. Jain made a point that diet means, say if you ask 10 people, 10 will advise you different diet. And one should not stop all 10 diets, because our diet must be balanced, and we should not stop eating everything. So if you have a symptom with more than 3 diets, be sure about it, it's not diet related. So therefore, we need to understand that which diet, which particular food which leads to repetitive symptoms. आज खाया तो आज symptom हुआ, कल खाया कल भी symptom हुआ, और परसों खाया तो परसों भी symptom हुआ. But otherwise, if you don't eat that particular food, your symptoms are not there. That's a direct symptom-diet relationship. And this we must appreciate, that one should not stop eating everything which leads to symptoms. It must be specific and it must be repetitive. खाने से होता है पेन तब तो बात बनती है, otherwise it may not have a direct relationship. Second, so slight amount of diet control, and you maybe play the best role, because no doctor can ever tell you that this diet is good for you or this diet is not good for you. You are the probably best judge that which diet fits your symptom. Maybe avoid that particular diet. Maybe that avoid that diet. Second, that undue anxiety and stress, certainly they are both ways. There are drugs for that, and there are also different kind of psychotherapy need to do. So these two principles must be adhered to, because they are modifiable factors. And third one is different drugs.
Right.
Yeah.
So, Dr. Satyaprakash, when it comes to diet, these days there's so many fat diets, and we do these diets for many reasons: weight loss, somebody's on a keto diet, somebody's on a blood group diet, somebody's on a metabolic syndrome diet. They're all kind of diets for all possible reasons. Now, if I have IBS and, maybe the diet is suspected, and the doctor says, try to identify what is causing the problem. So say I start eliminating dairy and I start feeling better. But then what happens is then I know that is the reason that is causing my problem. And, sometimes this triggers, eating behaviors, disorders itself. Dietary restrictions and elimination diets can, have a snowball effect, and the fear of experiencing symptoms after eating can also create a stressful experience. Some people feel, I'm going to go out with my friends, they'll be having pizza, and I won't be able to eat because, I'm not good with dairy, and dairy is going to cause my symptoms. So, at one point you're trying to reduce the stress, and even, elimination diets are leading to the stress. So what is the best way out of this?
See, first of all, you should accept that food is the last to be blamed. Large majority of us can tolerate a variety of food items compared to Westerner diets. Our diet already contains a variety of food items. We are exposed to, if you see a balanced meal of a South Indian or North Indian meal, it has salt, pickle, some curry, some curd, some dahi, chawal, roti. Everything is there. Our diet is already a balanced and a full diet. So the problem with the people is they get biased by the media, friends, unnecessary extra information, Google, so many things. Everybody advises for so many things. In fact, we have to declare the so-called a healthy person as a healthy. That is a challenge. So people think that they have so many problems, and we have to make them clear that their intestine is fine and they are already taking a good diet. So the so-called types of diets what you have mentioned suits to different type of people. Obese people diet, diabetic people proper diet, hypertension diet, metabolic joint diseases proper diet. But if you ask me, is there any good diet for an IBS patient? Say IBS fellow can eat anything and everything. Only thing, he has to be open that I am a normal person, I can digest everything, which I have been eating and drinking all these years. Suddenly at the age of 35, 40, he cannot say, I cannot digest milk. I cannot eat the chapati or thing like that. So these are all the things, some false information gets into it. I have patients who say, sir, मुझे कुछ भी सूट नहीं होता. I am just drinking only curd rice every day. So that is what the amount of stress or misinformation they are fed with. And in such cases, we have to tell them, you challenge or you introduce one food after the other and see what happens. In fact, as Govind was mentioning, the food that is responsible for symptoms should cause symptoms at all the times when the food is exposed. You cannot say, today I ate chapati, I have problem. Tomorrow, day after I had chapatis, I didn't have problem. Day after tomorrow I ate. So you cannot blame the food for that. So you should not unnecessarily eliminate a diet which you have been used to for a long time, and unless something which you have extra used. In fact, these days, the media is so much that, you see in the radio advertisements, you eat oats for breakfast, oats for lunch, oats for snacks, oats for dinner. I don't know, suddenly the people get so much worked up that oats is the thing and rice and wheat are not. So imagine a person who is not habituated to eating oats, and he goes through the bombarding advertisements day in and out, and he changes the diet to oats for breakfast, oats for lunch, and oats for snacks. Naturally, within next week, he will have a problem. See, oats are a high FODMAP diet. So diet is to be looked at as a divine gift to us, and we should not unnecessarily shortlist, blame, blacklist any food items without any specific reasoning. Welcome everything what God has given to us. We welcome everything, and let us not abuse them. That's what I tell them, and after that, most people are very good in managing their own diets. So once have a clear-cut concept that it is not the diet that is responsible, my perception about the diet is the problem. So once you accept that everything is good, then you can easily select out what is really not good, which are just one or two items.
Okay. Dr. Jain, then, your mindset, your beliefs, your perception about food, your habits, your lifestyle are important in the management of IBS. So would you say that, we should start early on and bring in these lifestyle changes itself so that we don't even get near some of those psychological or perception related problems that come with IBS? Like, you can tell children early on, eat a variety of food, go and exercise. Now, as a working professional, I don't like to invite the stress. This is my environment. I have to sit at the desk all day. I don't get enough exercise. All the gas gets filled into my abdomen, and by the end of the day, I'm uncomfortable. So, do we start bringing in, the acknowledgement about a healthy lifestyle from the beginning, so that we don't come to this stage where we're having a lot of IBS cases? Dr. Jain, request you to unmute yourself, please.
Okay, so question is regarding healthy lifestyle right from the early stage of your life so that you don't get IBS. I think what is happening these days is we are too much obsessed with this healthy lifestyle. What is healthy lifestyle? Healthy lifestyle is enjoyment. See, we should not force anything on anybody. Today, doing an exercise has become an stress. Oh, this is my time, 5 o'clock, I must do an exercise. Tomorrow, oh, yesterday I did only 30 minutes exercise, I must have done 45-minute exercise. Today I should have done a 10-kilometer cycling, oh, I have not done it. So anything, healthy lifestyle means there should not be a particular stress for doing something. It should be a simple life which you enjoy. So when you get up in the morning and going for a leisurely walk or a stroll, it's perfectly fine because that's an exercise. If you enjoy cycling, do it. If you enjoy playing a football, enjoy it. But that doesn't mean that you should not do anything. If you don't do anything, then you have other problems. So, number one, should not force any kind of a lifestyle on anybody. Each individual is different. Each individual has a different lifestyle. Each individual has a different way of working. Each individual has a different way of enjoying the food. So let them do that, number one. Number two, there is no food which is bad. The only food which is bad is when you read in a newspaper, you read on a Google, and then start experimenting that food on yourself. Oh, I will eat this, then my brain will. There is no food which can improve your memory overnight. Number three, unnecessarily don't stress for anything that I have to do this. If you can do it, perfectly fine. So if you have to have a healthy lifestyle and exercise is a part of it, that doesn't mean that you have to do all 7 days for every day, 1 hour. No. Even if you do it for four days in a week, it's perfectly fine. Third, whenever you are going and enjoying your food, something Dr. Makharia said that sweets are bad, but sometime when you are going to a marriage or you are going to a birthday party or you are going somewhere and everybody else is enjoying a cake or everybody else is enjoying sweet, enjoy that particular moment. Eat something which you like. If you like rabdi or you like sweet and you're taking one particular portion or one particular piece every day, it doesn't make your life absolutely not unhealthy. So another important thing is that don't put too much of stress on everything. And lastly, there should be a balance. And this balance again should not become a stress on you. When you try to balance between your home life and your work life, and then it becomes a stress. Don't put a stress. What all you can do, do it. And have a habit of saying no. If something which is not possible, be bold enough to say no though. Okay, this is not possible. Fine. If I cannot do it, perfectly fine. But don't take unnecessary stress on that. And lastly, don't have a monotonous life. Have certain breaks. Enjoy your passions. Enjoy your hobbies. If you enjoy your hobbies and passion, that also helps you in mitigating your symptoms, and you will not have many of these symptoms if you have a good, enjoyable lifestyle. There are no, within the bracket, written rules of the lifestyle. Each individual is different, each person is different, and each person will have a different perception of the same thing. So we have to accommodate all those things and then explain them about the lifestyle.
All right. Now we're coming to the end of the show, so I will take some concluding remarks from you. Dr. Makharia, let's start with you. For those who have IBS, what would you say that they should do so that they can cope better?
IBS is not a bad disease. It will never lead to, risk to your life. IBS symptom will certainly may decrease your quality of life, and therefore listen to your doctor wherever you've gone to, explain to him or her your problems, and also tell them that and since this through this kind of conversation you would have understood that diet does play a role, the stress does play a role. So explain to your doctor that what kind of diet I should avoid or so, and their drugs will prescribe. Please keep taking it. Hopefully your symptom will get better. but most importantly, get reassured that IBS will not lead to, any adverse effect to your life.
Dr. Jain, your parting shot, what would you like to say to those who have IBS, those who are listening in? Dr. Makharia says it is not a life-threatening disease and you can positively manage it. What would you like to say?
I'll just add what Dr. Professor Makharia has said. IBS is not at all a life-threatening disease. You will never get any shortening of life, or you will never end up with any kind of trouble when you have to seek a doctor in emergency. Other than that, I will go a step further. IBS is not a disease. I'll tell them that it's not a disease. You just need little modifications, little assurance, little lifestyle changes, and be happy. Be happy and be happy. Your IBS will be taken care of.
Dr. Satyaprakash, what would you like to say in conclusion to all those who are watching to try and understand and cope with IBS?
So I would like to reiterate what my predecessor, Dr. Jain and Dr. Makharia said, definitely. See, the first and foremost thing in IBS wanted to learn is there something wrong which will affect their life? So first you reassure them it is not a life-threatening disease and it will be there. Number two, any particular medicines need to be taken for a long time. Next thing they are worried about, they are taking medicines for a long time. So we have to reassure and tell them medicines are only beginning to make them to come back to the normal lifestyle, and that is not that they have to take the medicines forever like hypertension or diabetes. So once you reassure them that is not serious, you don't require medical assistance forever, and you can lead as normal life as possible with all the normal foods they can been eating and they can eat in future, 99% of the problem is solved. This will take a lot of visits for them to the doctor. It is not possible that they'll see me today and then tomorrow they'll be all right. That so-called reassurance factor need to be re-emphasized on subsequent visits, and then once they get into that habit of understanding, they will say that. I have so many, most of our consultants and my friends have so many patients who are thankful that they saw us at one point at their thing and then they're happy and then all right now. So many people regret that this sort of an advice and this sort of a patient hearing, they didn't get it elsewhere. So probably this is what they require, it more of our time rather than not much of our medication. They will be all right.
All right. So as much as diet is an important bit, even your sense of well-being, your happiness, your anxiety can have a big impact on the IBS symptoms. And like all doctors have said, this is not a disease. These are just symptoms that have to be managed, and you don't have to take lifelong medicines. It's not life-threatening either. I would like to thank all of you for spending the time to join us and discuss this entire issue, so that the larger public may be more aware of the symptoms that exist for IBS, because like you mentioned, a large proportion of the population would have some gastro issues. So this is really good awareness for everybody to understand what IBS really means and what are the options open in front of them to seek treatment, to take medication, to improve their lives and the quality of their lives. Thank you so much, Dr. Satyaprakash, Dr. Makharia, Dr. Jain, and Dr. Goswami for joining us and sharing with us the wealth of your knowledge and experience. I'm sure the audience has a lot to take away from our discussion. Thank you so much for joining us.
Thank you once again.
Thank you. Thank you.
So we'd like to thank our experts who've taken the time out to join us today, and the audience for patiently listening to their words of wisdom. Do follow our page, the Ajay page on Facebook. We have a lot of updates on issues that affect your health and well-being. Do follow us and like our page on Facebook and stay connected. We have lots of updates coming in about your health and well-being. Thank you so much for watching. Goodbye.